Hello everyone, this is Dr. Mac here with my video number 8. Normally just the days have been really busy and I'm not getting much time, so I thought today just make a small video while I'm going to back home in my car. So today's video is all about just a bit of basics about communication. I feel I've been actually trying to make a communication video, just not getting enough time to do that. I will be making a proper one very soon. However, this is just a quick one today, just to give you a bit of highlight and a bit of tips and tricks. How do you begin? First of all, very essential and important to understand is you don't need to buy and pay money for notes. Now, a lot of people are not gonna like me for that, but trust me, if someone's selling you notes, do not buy. Trust me, you can buy. Again, I'm nothing against that. However, everything is already available. You have version 4, you have therapeutic guideline, you have a bit of Odell's cases. You don't need a lot of notes. It's all about discussion. So if you can practice with one of the mate and have that version 4 and therapeutic guidelines, all the cases, you already know what the questions are coming in the exam going on. That's more helpful rather than getting notes and getting different presentations and getting like different courses that give you more information. Whenever you for example say that, okay, let's pick one course, ask them if you're gonna do role play. If they're not gonna do role play and practice with you what exactly to say in the exam, in my opinion, that is not very helpful. Because if you go and listen to a presentation, then you'll be highly impressed that, oh my god, I've got so much knowledge now. That is not bad. It's gonna help you with your clinical life once you're already a dentist and somewhat help you for your exam purpose as well. However, it's not gonna help you much for the exam, because for the exam you need someone who exactly tells you that you need to prepare like this, you need to exactly say this in the exam, and this you can't say. So you need a bit of role playing going on. And this is the bit of course you need to take. If you go to someone and they say, oh, this periodontal disease is about this, and caries risk chart is this, but if you don't know how to present that to the examiner, it is not much useful. So again, communication is all about how to actually, the OSCE exam is all about how to actually communicate that information to the examiner or basically to the patient. That's all you need to do. You don't need 200 books to read. You don't need to buy notes from anyone. You just need that basic information, and you need a bit of course or someone who can help you again and again along with the grading criteria, what you need to say in the exam, how to effectively communicate in the exam. Which are the things you can say, which are the things you can't say. And when you study like this, your communication will automatically improve. And again, as I always say, ADC has given you a very straight dead grading criteria. You have to read it, you have to understand it, and you have to follow it, implement it. That's all you need to do. If you do that, you're automatically going towards the passing stage. However, if you feel that, everything's, I know I've done so much course, I've read 200 books. If you have so much knowledge and you can't concise it in your mind and implement it in the exam, it's not very useful. So again, I'm completely against buying notes and stuff. I feel all the information is already there. You can make your own notes if you want. That would be really helpful. There's nothing wrong in buying notes, but I would say all the information is already there for free. Just have to work hard on it and just gather all that together. Version 4, again, is one of my favorite documents. I think whoever created it, I think Denham, hats off to that guy. It's a very good document. It tells you what to do. Definitely, it's not a perfect document. Not a perfect document. couple of things, ups and downs in the version 4 as well. However, one of the most nicest documents you will find, all the scenario questions are there, everything's there. They exactly tell you how to start or to finish, what points to cover, and very, very helpful. So I would personally say that for communication, it's all about practicing. If you want to take a course, might as well do it. Definitely helpful, but make sure they're helping you with that role play as well. If they're not helping you with the role play, and if they're saying that, oh no, I'm gonna just give you a nice presentation, you can have 200 presentations on YouTube exactly telling you even better than who's gonna teach you. So we need to know exactly whoever's teaching you that, okay, that's fine, you've given me information about implant or peri-implantitis, tell me exactly what to say to the examiner, or tell me exactly what to say in the exam. And if you can't do that, then that course, in my opinion, is not very helpful, to be very honest and to be, very upfront. Okay? So yeah, for communication, you need to make a strategy. You need to exactly time it. I have a bit of a chart and a flow chart that I've made. I will share it on the page for everyone. Possibly at the end of this video, I'll attach that flow chart. One is for the grading criteria. One is for the timing. Timing is very crucial. If you feel, and majority of the time that's what we say, that my communication is great and I don't really need to practice, you're cheating yourself, and it's gonna hurt you back or bite you back so hard that you're gonna be, like swearing at yourself and won't be happy with yourself. Because the problem is when we say that, oh yeah, my communication is great, I only don't know to do anything, I'm well aware coming in and covering in everything in 10 minutes, what happens is, yes, maybe 70-60% of the time you may do it really well, but in the exam, especially when you have a bit of anxiety going on, that is quite normal, and obviously you have some going on, okay? And then again, a bit of stress and all that situation, you miss a couple of points. And then what happens, you don't even realize what points have you missed or not. And then even if you haven't missed any points, sometimes what happens, you're there, 50% there and 2 minutes remaining, and then you're now panicking, why did I not cover? Because you did not practice at home. So whatever you practice at home, you exactly gonna replicate in the exam as well. So time everything. First 30 seconds, break the ice. Just a bit of communication. Hello, how's your day going? My name is Dr. Mac. I'm one of the dentists here. I'll be helping you today. Secondly, very, very important. If there's an angry patient or if someone is in pain, you cannot start with, hey, how's your day going? Because then they'd be like, hey, I'm in severe pain, man. Definitely my day is not going well. Can't you see? So we can't just have, greet everyone like, how's your day been? Hope you've been fine. To everyone. Okay? So that also varies from scenario to scenario. Some scenarios you definitely will say that, hey, how's it going? My name is Dr. Mac. I'll be helping you today. How's your day been so far? Something like that, just to break the ice. And then you just introduce yourself like I just did, and then just say, I will help you today. Another most crucial thing we need to understand here is, which a lot of people say it and they don't realize it. They say is, hey, my name is Dr. Mac, and I will definitely solve the problem for you today, so you don't have to worry. Now, this is very wrong. You can't say that I will solve the problem for you. Your job is to tell them that, yes, I will try my level best to help you today. Or let's have a look and see in what way we can help you today. But never say I'm going to solve the problem. However, you have to refer it to the specialist. However, you cannot give him some treatment today and you have to bring him tomorrow, just some painkillers. So never promise anything. Just say, I will try my level best to help. That's it. Then comes the chief complaint. So whatever the chief complaint is, if they're in pain, if they need medication, if they need to know about implant, whatever is the main idea, or if you need to take a consent, focus on that one first. Okay? Then after that, you quickly go to the medical history, social history, dental history, blah, blah, blah. However, they shouldn't take you more than 60 seconds. Now, a lot of people say I spend 2 minutes. When I practice with someone, they're taking 3 minutes to take a medical history. And I'm like, you can't do that. You won't be able to finish in 10 minutes. So the basic question you need to ask, do you have any medical conditions or allergies I should be aware of? If they say no, okay, do you take any medication? Sometimes they say, yes, I do take aspirin. Why are you taking aspirin? Because I had a stroke last year. And then they're going to say, yes, I have a bit of problem with my brain, or I have a bit of cancer. So now they're going to, take it out. Because first they said, no, I have no issues. But now they're going to tell you that, yes. So there's a way of asking. But again, couple of questions. You don't need to just dive into the medical history and stuff. Perio case is very important to have a social history, halitosis patients and stuff. Okay. Basic questions. When was the last time you had a dental checkup done? Do you regularly see your dentist? Blah, blah, blah. 60 seconds. Boom. Go to the next one. Now what you need to do is formulate a plan for them, or formulate a provisional diagnosis. Now there's two sort of diagnoses we make. One is a provisional diagnosis. One is a definite diagnosis. Provisional diagnosis, and we clearly say, based on what you have just told me and the history I've taken and the signs and symptoms I'm seeing, on the basis of what you've just told me, you may have something called as a nerve pain, or you may have something which is called the dry socket, and then explain them that the pathophysiology of that. Now, you didn't say that you have this, but you say, based on what you've been telling me, it seems like you may have something like this. However, I would still need to follow up some tests to give you exactly what's done. And sometimes they say, can't you tell me now? Say, in dentistry, we really need to figure out the final diagnosis with the help of a couple of things. One is the history that I just took before, and the signs and symptoms that I saw and you told me about. So signs are what you can see, symptoms what the patients tell you. Okay? Second is radiograph. Very important to have a radiograph. And third is your investigation, or your clinical sort of like investigations that you do. These three things formulate a diagnosis, which is a definite diagnosis. Because the provisional, you can see an x-ray, you can say, yeah, this looks close. However, I need to tap your tooth as well. I need to do some cold tests as well. I need to do some other tests like vitality testing and all blah, 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 to give you an exact thing that if you have nerve pain or not. Something like that, okay? So they all of the things that are going, and you have to just follow everything in order, because if you don't do, you'll miss one. After finalizing provisional diagnosis and explaining them what's happening, take a consent if you have to. Then we go to the final. Like if we need to advise them that you have to take an x-ray, or we have to conduct more tests, we have to take a 3D x-ray, we have to do some, because there's a crack, we might need some illumination test, we might do this and that, we may have to refer you. However, based on what you've told me, you have something, this, it can be one of the three, but you never tell them that, you have exactly this, because you haven't taken all the things you need to figure out. Okay, so there's some of the things we need to understand that really help us to formulate a diagnosis. Okay, then what you do is at the final ones, pathophysiology we have already done, diagnosis you have already done. Then you say that if they are in pain and if you can't do anything today, advise them painkillers. If they have a big swelling, make sure you do the drainage first, then you refer them. Don't just refer them straight away. If they have a big swelling and you can't do anything, do the drainage, give them antibiotics, refer them, but tell them that because you have due to the severity of the condition and the specialist can't see you in 2 weeks. Now a lot of people say a specialist can't see you in 2 weeks, so I can just drain it for you, and then if you have any concerns, go to the hospital. However, you forget that, can you not call to the specialist and let him know that he needs urgent treatment. A lot of people say that, there was nothing there. So it's everything, you can make it up. And that's exactly what we do in the clinic scenario as well. Clinical scenario in everyday basis. Like some patients can wait 3 weeks, but just tell them, because, your condition is quite severe and that there's a big abscess, you have a bit of fever as well. This shows some systemic signs as well. What I would advise you that I'll ask my practice manager to call the specialist and talk to their receptionist staff or managers to see if you can get an earlier date, because we can advise them about your condition. It's quite severe now, and I can request them myself as well. So the examiner knows that you know a bit of these things as well. You're not just waiting. Second thing, you tell them that, however, if something starts, we can send you to the hospital if we can't get you an emergency date to the specialist. And third thing, if you can't do anything, and even if you wait to 2 days, make sure you advise them and inform them that this can be a critical, life-threatening situation. I'm not trying to scare you, sir, but it's my job as a dentist to explain you everything in detail. So what I'm trying to explain you is that in the night time, if you feel that your swelling has increased a bit, it's hard for you to breathe, or it's hard for you to swallow, your mouth is a bit more closed, the fever is a bit high, make sure you call the hospital and go to the hospital straight away. Make sure you're not waiting for me till the next day. Okay, so these things are very important for them to tell as well. If it's a big abscess and things going on, make sure you're not just prescribing amoxicillin, you're prescribing metronidazole as well to cover the anaerobic bacteria as well. Okay, strong painkiller. If he's asthmatic, make sure you can't give him non-steroidal anti-inflammatory drugs. Okay, so there's so many things going on, but if you try to do that in order, that really helps. Now what happens is, if someone says that, for example, you have to take a consent of a restorable tooth, now what people do is they waste 7 minutes on restorability. They have confused you in the end, that take a consent for tooth 4-6, your patient is here for an exo 4-6, take a consent before proceeding with the extraction. However, the tooth is restorable. Now this is a question. Now what people are going to do is they're going to spend 7 minutes talking about the restorability. Did they explain you all? And the patient will be like, no, they did not. Now you're just talking about restorability and root canal and what you can do to save the tooth, but you completely forgot, or you completely forget that what did they ask you in the first place? To take a consent. That was the main question. Now what you did is you didn't take a consent, you focused toward the restorability. So what's going to happen? Can you pass the exam? You cannot. Always very important is to look at the question. What's the question asking you? If they're taking manage the case, then it pretty much covers everything. If they say that the history and everything was already taking, make a treatment plan, that means already is there. Have a quick check and say that I know that they have checked it for you last time. I just want to have a quick check again. I know it's not very nice and you may not like it. However, any medical conditions can correlate with the treatment plan or the treatment we provide. So just bear with me for next 30 seconds. I just want to quickly confirm it. If you don't have any medical condition, allergies, again 30 seconds. But go to the treatment plan, go to the treatment, go to the management. Don't waste too much time, because the question is saying management. If you're wasting time in history, this is not going to help you again. Okay? So again, look at what the question's asking you. Look at what you have to do. If they're saying consent, focus on the consent first. Once you have done the consent, then say that, how I've taken the consent, we can proceed with the treatment. However, I may need to advise you before we proceed is that this tooth can be saved. I hope you're aware of it. Are you aware of that this tooth can be saved? Then you focus on wherever you want. But if the 10 minutes end and you didn't talk much about restorability, they cannot fail you. However, if you don't talk about consent and if you didn't take a consent, nobody can pass you. Again, look at the questions, what the question is asking you. Another very important thing, layman language. Just imagine you're talking to a 6-year-old. How will you talk to him? This should be in your head. That this tooth has a top bulky part, and then normally we grab the tooth and do some movements to wiggle the tooth and then move it out. However, if the tooth breaks at that point, then we might have to section the tooth to remove it into 2 or 3 or several pieces, depending on the case. However, if after removing the tooth, if we still feel that the tooth cannot come out and it's a bit more complicated procedure, we may have to refer you to the specialist. Simple as that. Another thing, consent. Very important is you have to give them option of a specialist. It's a legal law in Australia. Every time you do a procedure, even root canal treatment, even an extraction, you have to tell them same procedure can be done by a specialist as well. I hope you're aware of it. It's my job to tell you. I'm very confident in doing my procedure. My success rate is 95%. However, I just want to advise you that the same root canal I'm going to perform today can be done by the specialist, okay? And I can refer you to the specialist directly to get the treatment done. Would you like me to do that? Again, they might ask you, why can't you do it? No, I'm 100% confident in doing this procedure. My success rate is 99.9%. You can even say that if you want to. However, it's a legal law that it's my job to advise you, being my patient, that these are the options you have. So if you like, same treatment can be done by the specialist. However, I'm very comfortable and confident in doing this procedure, and I'm happy to proceed. So, it's all about how you talk. It's all about how you talk. I can do the scenario in 5 different ways and nobody can fail me, because again, it's very important that you put it in your head that each and every word you're taking out of your mouth, can you justify it? So if I say that, I'm referring to a specialist, can you justify it? At the back, I can. That means nobody can fail you. Again, another thing is consent is very important, guys. I think we neglect the importance of consent. We think it's the most easiest thing. However, whenever I practice with someone, I fail them in consent straight away because they don't know how to take a consent. Okay? You need to know exactly how to take a consent for exo, both for a lower molar and also for an upper molar. For a lower molar, again, we have to talk about the 2 nerves. Upper molar, you have to talk about the sinus. So it's a tiny bit different, but very similar. Similar things can be used. However, we need to talk about a bit of, the sinus and stuff. And again, you need to know how to explain the sinus in a layman term. How to explain about the nerve in a layman term. All the complications in a layman term. Also, exo consent is not just about exo. You should know how to take a consent for a filling. You should know how to take a consent for a whitening treatment. You should know how to take a consent for a root canal treatment. You should know how to take a consent for an implant. Again, a lot of people say, I don't do an implant. Doesn't matter. ADC doesn't want you, or is not asking you to do an implant, but you need to know everything about an implant, and not everything. We're not talking about the diameters or the measurements you need for a lower 6, or what measurement implant you need, or length or width implant you want to put, or if you want to replace a 1-1, what implant you're going to put. They're not going to ask you that. However, you need to know the basics. Why are you doing an implant? Is the bone grafting options available? If you don't have a bone, if there's a smoker who wants an implant, what protocols will you follow? Will you just say you can't get an implant, or they can still get an implant with certain precautions? So there's so many things. When we talk about communication, in my opinion, these are the things you cannot learn in any book. No book will teach you this. It's pure communication skills, and it's all about what to say in the exam. That's why I tell everyone that feel free to take any courses. Do not waste your money in buying notes, in my opinion. However, if you want to, it's your choice. You can take any course you want or buy any notes you want. However, I would advise you, any course you take, make sure they practice with you role play. And by doing that, that means they put a timer for 10 minutes and they say, let's do a scenario. And once you finish the scenario, they tell you your mistakes, that, okay, you did really good. However, I'm not gonna pass you because you did not cover those 5 points or the 7 points. And if you miss that point in this scenario, which is the most crucial thing, you cannot pass this exam. Every scenario has a couple of things that they want you to cover. That again, every scenario differs from one another, right? So it's very important to understand that not one law or one scenario or one outlet in our mind, that we say that I formulated a plan and I'm going to follow in every case. It's not going to work. However, if you say that I have a bit of an idea how to start and finish, in what time order I'm going to do, but this scenario I can change that a bit, this scenario I can change that a bit, however 70% remains the same, and that works really well for you. Okay, so communication, guys, it's all about practicing. Practice. Another very, very important thing, never practice with someone who is at your level. There's no harm in practicing, but the only problem is if you and your friend are practicing together and both are fresh, if you have no one, it's good to begin. There's no harm in that, but you're not gonna learn anything. So you three people, I normally have a chat with people and they tell me that, we three friends, we're amazing friends and we practice together. But now what's the problem there? We forget that our friends, they're good friends, we're good to hang out, but if we three don't know, we three are gonna fail because we three don't know and we're not improving anything. So you need to practice with someone who's a bit better than you and he can tell you, and maybe half of the things you're good, half of the thing he's good, and you relate it. I had a group of 5 to 6 people. We'd come check everything, each other, and one person used to say there's 3 mistakes, other person used to say 2 mistakes, 5 mistakes. So this all about different scenarios, all about finishing in. I normally say at home you should be finishing at 8.5 minutes. If you can't finish at 8.5 minutes, that means you haven't practiced correctly. In the exam, I finished all my cases at 9 minutes dot. 9 minutes, I finished my scenario. Last minutes, I was having a chat with the examiner or the patient saying that, I hope I've explained everything to you correctly. Do you have any other questions for me? And they said, no, you've explained really well. Everything's okay. So I was asking them, so what are your plans for the rest of the day? This is what we do. It's all about managing a patient. It's not about just managing on that tooth there. You have to manage a patient as a whole. That's why if they have a medical condition, if they are a smoker, okay, if they're suffering from anxiety, if they grind their teeth, if they snore at night, if they have a limited mouth opening, okay, if they haven't seen a dentist in the past 5 years, it's your job to inform them about everything, about smoking, about anxiety control management protocols. Okay, how to do that? I can refer you to someone. I have some helpline numbers you can do. Smoking, I know it's really hard for you, and I'm going to tell you that stop smoking tomorrow. I know it's very hard for you. However, it affects your whole body mechanism as well. So it's so many things you have to talk about them. Smoking protocol, smoking cessation protocol, anxiety control management. If they haven't seen a dentist for 6 months, tell them, it's very essential to see the dentist every 6 months. Brushing twice a day with a fluoridated toothpaste, after breakfast, before going to bed. Have a sip of water through the entire day to neutralize the water effects, reducing the frequency, reduce snack between meals. They're basic things. And you talk like that, they would say, he's covered 75%, 60%, 80% of the scenario. They're going to pass you already. So there's so many things you can do, so many things you can't do, but you have to practice in the right way. I will make a video very, very soon as an orientation session, how to communicate and the basics. However, just to give you a quick idea, because I was seeing a lot of posts, so I was just making sure that, please do not invest your money or waste your money in buying notes. There's everything already available. Okay, you don't need a lot of knowledge. You already have a lot of knowledge. You have passed your part one already. Every knowledge is available in books and YouTube videos. You just need to know how to present that knowledge. That's all you need to know. Okay, how to present that knowledge, how to communicate effectively. That's all you need to pass the communication exam. Okay, hope that helps, and we'll see you with another communication video very soon. God bless everyone. Bye.